I tell my patients to think of them as a false fingernail. Now, most dental veneers, depending on whether you do them with porcelain or with preformed composite or even composite bonding, are a thin layer. They're usually not greater than 1 millimetre in thickness, and they actually sit on the actual facial surface or the front surface of the teeth. And they're mainly for improving the colour and the appearance. I mean, they are an aesthetic treatment. You can actually change certain amounts of angulation and chipping with certainly porcelain veneers, but as a general rule it is more to actually increase and make the aesthetics of the front teeth improve. If you find porcelain veneers, you should look between 8 to 12 years. Now that is obviously an average, and averages will always statistically be dropped by people who don't really take care of them. But if the home care is fine, I would tend to look for 8 to 12 years. Porcelain veneers don't discolour. Where they join onto your teeth can actually pick up stain, and that is one of the things that has to be basically checked yearly to make sure that if any staining is being picked up, is actually cleaned and maintained as best as possible. Composite resin veneers, they certainly can pick up more stain. They do tend to be a little bit more rough on the surface, and as such are able to pick up a little bit more stain and do change colour a little bit more. But as the technology of composites increase and they've gone into the nano side and the smaller particles, they do tend to actually be much better these days than, say, perhaps even 10 years ago. As a general rule, we like to actually whiten the teeth before we actually put veneers on, especially if there's going to be multiple veneers. So if you're doing the front 6 teeth, for example, it's much better if the base underneath the veneers, because they are quite thin, are as light as possible before you actually go ahead and do it, because that way you know the result will be as best as you can achieve.